After one has a shoulder replacement, our hope is that you never need a revision surgery. But certainly we know that complications happen and active lifestyles happen as well. And I think the younger you are when you have a replacement, there is always the risk, especially if you're active, that it could wear out and lead to the need for revision surgery. That being said, the long-term research shows us that while the x-rays might show that your shoulder replacement is loosening or starting to wear out, not many people actually need a revision because we don't walk on our shoulders. And so a lot of patients are able to cope with the shoulder replacement starting to loosen, if it does, much better than if it was a hip or knee and you had to walk on that. So we hope that you never need a revision, but we know that the replacement can loosen. The normal shoulder replacement, the research shows 10 to 15 years we might show signs of loosening. And the reverse probably has a little bit better longevity as long as there's no complications. Complications do lead to revisions. So if you have an infection, that definitely leads to a revision. If your shoulder dislocates, that's going to lead to a revision as well. And if you have problems post-operatively with your rotator cuff, if you have a traumatic fall, you could tear your rotator cuff or you could break your arm around the replacement. But that level of fall would potentially break any other bone in your body. So that's the amount of force that you would need. But if you fell on your operative shoulder and broke it, you could need a revision. So we truly hope those things don't happen. Revision rates are probably, in the single digits, but we know they're real. But thankfully at Ohio State, we are all shoulder fellowship trained. All we do when you see us is operate on shoulders. So if you need a revision, you're in good, capable hands.